Hello, hello, everybody. All right, I'm going to call in my fellow panelists today. We have an interesting panel. Dr. Stephanie Rimka, Miguel Bertonatti, and then Olivia Didina. So this is an interesting panel. So this is all about revitalizing sexuality and biohacks for sexual health and vitality. So really interesting. So Dr. Rimka, please introduce yourself.
Thank you, Dr. Rudy. Dr. Stephanie Rimka. I am in private practice in Atlanta, Georgia. I specialize in mental health, and I do that via brain optimization. And although I'm kind of known more for autism, vaccine injury, special needs, schizophrenia, bipolar, believe it or not, sexual health plays a huge part in people's mental health. And it turns out it's something almost nobody talks about with my patients. I'm the first one to even bring it up, and it's kind of how I've fallen into. When Rudy met me, he's like, "Are you a sex therapist?" I'm like, "No, but I'm apparently the first person to ask any of my patients about their sex life."
Amazing.
Yes, your talk was wonderful, by the way.
Miguel?
So, my name is Miguel. I'm the founder of Medical Health Institute, a practice that we maximize human performance for biological excellence. And I'm a former recovered ED patient, so I have a lot of...
Say that a little louder.
A recovered ED patient.
Say my line. Say it. Do it. Do it. He's gone from...
From pain to purpose. So yes, I have a lot of input on the psychology and physiological aspect of what it is to have gone through that journey, and many solutions on how to solve it. So if any of you in the room have it, it is totally fixable. So there is a bright side to it.
Thank you, Miguel. Olivia?
Hello, my name is Olivia. I am an intuitive sex and intimacy guide, and I help you orgasm and soulgasm. And really, when it comes to biohacking, I help you reprogram your nervous system so that you feel safe to receive pleasure and surrender to your body's wisdom. So I'm on this big mission to change the frequency of sex, and how we experience it, how we view it, and bring more conscious intimacy into relationships.
Amazing. So amazing to have amazing panel members like this. So the title of our talk today is Revitalizing Sexuality. So Miguel, I'm going to start with you. From a men's perspective, tell us what your journey on sexuality, what you've gone through, and what you've learned.
Right. So, by the way, I love how you mentioned about feeling safe, and I'm big on the sympathetic, parasympathetic side, which we'll explain eventually. But I first started having experiences with ED when I was 18 years old. And then 22 years of age, I clinically diagnosed myself that I knew there was an issue going on, right? And it took me on to an 8-year journey until I turned 30, and I basically found a solution, and it's a multifactorial approach. There's just not one piece of the puzzle, is treating the entire puzzle together. And I learned a lot of things in the journey. It's very important that when you do actually have diagnosed physical erectile dysfunction, that you treat it as fast as possible, because if not, it becomes psychological, and then to get over it psychologically, it's another hurdle itself, right? So very important, and feeling safe, feeling confident, and that you can get the job done.
Amazing. Miguel, thank you. And it's amazing that we have...
We both are like, okay.
Amazing to have such candor and vulnerability from a great-looking muscle guy, young guy who experienced ED at the age of 18. So we need to realize that this is happening. It's happening more and more. And, you found an answer for it. And you were able to fix yourself. And now you're sometimes too much great about it. But talking about this is important. So, Olivia, when you hear that coming from a man, tell me what you think about this.
Yeah, so this is what I like to call ED, erectile disappointment. Because oftentimes it is that disconnect between the body and the mind. So as you mentioned, the parasympathetic nervous system, that space that you can just relax and surrender. I mean, this is huge. If we're constantly on the go, 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 and we put so much pressure on ourselves to perform, right? It's not just in the bedroom, but it's outside of the bedroom. And our sexual energy affects all aspects of our life. So the more that we can become more self-aware of, what are our belief systems, what is really stored in the body, from childhood, and how we, view things, it really affects us. So yeah, I totally hear a lot of that, and I love how, you've overcome it.
Amazing. So, Dr. Rimka, so tell us your view about this, and I love your angle from this, because maybe some of the patients that you see dealing with mental health, with autism, you may not think that they need sex also, but yes, they do, right?
Yeah, it turns out when somebody gets, and I'm going to piggyback on this for a second first, and then I'll get to that. I love just, you can hear the language, right? How a male fixed it, and I went after it, right? And she had this, it's a very linear, masculine, beautiful energy. And then you brought in that very, circular, feminine, let's talk about the disconnect and the things and right? Like, So, he didn't really need to talk about safety per se, because the way we are hardwired is very different, right? The way we experience pleasure, men and women do not. I know it's controversial to say men are not women and women are not men and our brains are not the same, but they are not. So in the mental health space, or in any chronic illness space, right? I don't care if you're dealing with Lyme, mold, MS, lupus, right? The implications of anxiety, depression, insomnia, these are all concomitant with this. So you always are going to have to deal with it. There's trauma involved in a diagnosis. And the first thing everybody throws out when they don't feel good is pleasure in all shapes and forms, right? It's, I guess I would say healthy pleasure. I guess they'll go to sugar and Netflix and TikTok, right? There's like this addictive type of, like, I need something. And almost all of those forms of seeking some type of false pleasure, I would say, are numbing out, right? They're desensitizing you. You are dissociating. It is the exact opposite of what you need for incredible sexual connection and experience, which is sensation. You need connection with yourself, your senses. Every sense directly taps into the pleasure centers of the brain. And people are forgetting that because they're numbing out, right? So even the concept of biohacking sexuality is so masculine and aggressive and warrior. I can't stand it. I'm like, why are we hacking sex, right? It's scientists hack a problem. This is not a problem, right? This is an art form to be experienced, and there's this pleasure scale, right, an experience scale, but sensation is it, and you must start connecting with yourself, your own sensations, so you can connect with the other, right? And so I have to be able to know, what do I want, what do I like, can I express it to him or her, so in a comfortable way. That takes a level of deep embodiment, connection, and maturity that unfortunately our culture and in the mental health scape and in the sick scape just gets blown away. Like, how numb can we be? Let's take this drug, this molecule to numb it, take this salve to numb it, porn, vibrators even. It's just massive amounts of pressure and information coming into systems that really don't do it that way.
Amazing. You're such a poet with your words. Amazing. And I want to stay on this, and Miguel, I'll come to you after. You introduced a concept to me about conscious intimacy that goes very well with this. Tell us more about this.
Yeah, so I love everything that you're saying. So this aspect of sensation and really being able to be present with our body and what's coming up. So as you mentioned, it's like, how can I even connect to my partner if I can't connect to myself? And really what I teach is intuitive, like being in tune with your body. So that's the whole reason I'm an intuitive sex and intimacy guide, because I want you to really know what your body wants, what your desires are. As you mentioned, expressing those desires and knowing that it's coming from an authentic place, that it's not performative. And especially as you were saying, I've been talking a lot about how sex can be used to fill a void. And same thing, finding different partners. I was definitely the girl that was in search for love and what I call a love addiction. And it was always me searching externally for something, and it was never going to be enough because I didn't know how to source that within. So the more that I took ownership of my pleasure, of really tuning into what is it that I really want versus what is something going to give me. So that's been huge on my journey. So.
Amazing. So what I love with this panel, we're seeing 2 males, 2 females, and how our language is so different. Well, the women are all circular and beautiful and poetic, and me and Miguel are all, we got to get it done.
Get the job done.
Yeah.
Which we need, because that's what harmonizes
Yes,
us. Otherwise, I'm a wild hurricane just destroying all the islands if you don't come in and help direct me where I'm supposed to go.
Yeah.
Like, land over here, honey. Oh, okay.
Got
But
it.
so, and I think we've had this issue, that I've been writing about, like this concept lately, like this whole, divine masculine and feminine. It's like almost that's even turning into a battle in the woo-woo world. Like as if the now it's the feminine's time and the masculine must die and the patriarchy is awful and we've all been oppressed. I'm like, really? Because I don't really feel that way. Like, why are we going into now it's this cycle? It's like, why can't we, don't you understand, the left and the right hemisphere must come together in a harmonization and must communicate and integrate. And when you do that, that is how the nervous system downloads information from spirit. And that's how, our relationships work, whether it's in friendship, business, or sexual connection and intimacy.
Amazing.
There is this harmonization and the yin and the yang that's required, right?
Amazing. So Miguel, listening
Well,
to
I'm
all
saying
this.
it's safe. Let me go. So you know this about the nervous system, and you said it. When a man has a climax, right, orgasm. So the orgasm is a whole different thing. Like, we don't orgasm the same, right? I can orgasm for days. Sorry, but you can't.
Lucky.
We have big superpowers.
I don't even understand that.
Miguel, we're like, I'm asleep by then.
Yeah.
Like, how do you do that?
We do a totally different thing. And so orgasm doesn't mean climax either. They're not the same. So we've been forced to think of it, and I think part of what you're saying is this performative thing. Women, all of you are thinking of sex and the male standard of, okay, and the poem, and the stuff comes, and so we're supposed to do the same thing, and perform. And so people are doing that, but it's not, their brain lights up on a functional MRI, pleasure centers. That's all that happens when you come. I mean, pretty much. Us, completely different neurology is happening during that process. And our pleasure centers light up, but you must have inhibition in entire other parts of the brain. It's like zero activity of the parts of the brain that deal with inhibition, right? The parts of the brain that deal with me dealing with looking out for danger all the time. If I cannot shut that part of my brain off, I cannot orgasm. So this is why the safety for you to establish it is so important, right?
So let me add a couple of things to that, because there's so much to unpack between what you said, what you said. Oh my God. So number one, as a man, especially when you're young, you don't know how to interpret what's going on. It's 3 a.m, there's probably alcohol involved, that dilutes your ability to get an erection. Let's define an erection. Arteries have to pump blood to the penis, capillaries exchange oxygen and nutrients, veins take it back out. And for that process to happen, depending on your size, whether 1 pound or 5 pounds or whatever the amount of pounds you have for carrying, you have to be energetically calm, you have to feel secure, you have to feel safe, and you have to be present, right? And what happens is when you experience as a man that's where we put all our proudness, our masculinity, and all of a sudden I can't perform. It's like a dog with his tail under. Wait, say what you said.
Don't you think confidence or swag would be a part of that? You didn't say the word.
100%.
Okay,
Listen,
right.
I conquered the woman throughout the night. Now I'm in bed. It's the moment, and you can't perform, right? So as a man, it's a form of trauma, right? So then you start not to even talk about and dismantle the traumas that we already have from childhood. But the point is, we don't feel safe, we don't feel confident, And then energetically, I'm not in the right state because I'm not even present. I'm thinking, am I going to get an erection and be able to perform or not, right? And then you have, because there's a lot of things that you unpacked, what I call the easily unearned dopamine reward hits that we're constantly getting. Because let's address the 800-pound gorilla in the room, which most men are addicted to porn and video games. And you're constantly getting a dopamine hit. Then, aside from that, you have your social media, YouTubing, tweeting, etc. Right? Then the binge watching of HBO, Netflix. Then you have your smartphone delivering cheap digital dopamine 24/7 around the clock. So when we want to access, I'm aroused. I want to have that experience. Maybe I'll go home, jerk off. Excuse my language, but we're not. There's no reason why to earn things, right? Everything is quick. It's instant.
Instant gratification.
So I'll leave it there. But
so one thing that's interesting that I wanted to bring out is think about Viagra. When Viagra medication came out in 1992, it was doing a Super Bowl commercial. And the commercial was by Bob Hope, 72 years old senator. Think about one of those companies called Hims that sells Viagra online. The average guy who's buying Viagra online is 27 years old. So in 40 years, we went from a 72-year-old selling Viagra to a 27-year-old. So I think the point of this panel is to let us know there is a sexual problem. There is a sexual slump. And it's affecting both men and women, because sometimes when we think about somebody doesn't want sex in the relationship, we think it's only the woman. Well, guess what? When a guy is dealing with ED, he'll hide from his girl because he doesn't want this disappointment. So this is where I feel like that communication, that safety, that touch is really important.
Well, and aren't you talking about this tomorrow?
Yes,
Yeah,
we're actually
okay.
talking about.
So he's talking tomorrow about EDCs, endocrine disrupting chemicals, right here, right?
Yes, in the main
So this is the perfect example. I mean, this guy is stacked and jacked, right?
Look at it.
Gorgeous and like optimized, been biohacking, doing it, and he's living it. He lives it. This is real and authentic. I think I'm truly like so glad I know you and impressed and proud of you for doing this. Because there are a lot of young men out there right now that are 17, 18, 19. They have been poisoned. They have been traumatized by the EDCs. You're going to break this down, right? Mm-hmm. PowerPoint and everything?
Yes.
Yeah, it's unbelievable. He does an incredible job. Please watch it. So our children are being born sick, damaged, getting poisoned. They're getting poisoned in the womb. So their endocrine systems are not, they don't have the same testosterone. What is testosterone's down like 50% in the last 20 years?
Yeah. Sperm count decreased 52%, testosterone 40% over the past 4 years.
The stats are real. That is happening. We have a physiological, biological problem. And I'm going to say something nobody likes me to say. And I don't care because I have a problem with it. I'm a mother of an 18-year-old young man, and I realized at 9, oh shit, I'm raising a man. That changes everything. Like, he's not a little boy. Mm-hmm. I have to think, what's he going to be like at 20? So I have to start talking differently and demanding different of what my expectations. Like, you're going to be a man. I have to think of, he's not my little baby, And something I chose, to do because of the way I looked at it, and people don't want to talk about it. I don't know what you've gone through or not, but circumcision is trauma to little boys. So I don't understand the level, like, we don't talk about how many men, infants are being cut on their penis under no anesthesia without consent. We talk about all the trauma women go through all the time. The rape, molestation, the rates are through the roof. So you got to deal with all of that. Nobody talks about what the men are going through, that somebody cut off part of their penis. That was they're numbing you out, taking away sensation, all in connection and bonding, all based upon a lie in medicine, that you're dirty.
It's a little worse today, though. If you look at the current young 26-year-old today having ED, they're completely victim of these telemedicine platforms offering ED solutions. You go, you get the consultation. Now they upsell you on testosterone therapy. Hey, you don't want to lose your hair? Take finasteride.
Right.
And on top
Yeah.
of it, take this
Then you have incompetent medical
Check
care.
this out.
Yeah.
Take this drug that we call an estrogen blocker, which is really
Makes
a
it worse.
disguise for a chemotherapy drug. And if you look at the side effects of finasteride, is infertility, erectile dysfunction, loss of libido. Then the estrogen blocker, which is chemotherapy drug, neurologically toxic, decreases your bone density, increases your risk of cardiovascular disease, and also exacerbating the very issue. So I think that anybody who's reaching out for these companies, is very important that you reach out to a doctor who understands the risk and benefits of how to properly prescribe these medications, and for you to be advised on the side effects that they can have. Because what I've already met many clients in our clinic that go to these places and we tell them, hey, did you ever hear about the post-finasteride syndrome? They had no idea. I've never heard somebody say, oh yeah, they told me about that. Which they're not telling you the consequences of using these medications, right? And I took it when I was young. Thank God I didn't do that issue. Yeah. But basically, you know, we think, oh, let me take some medication that's gonna grow my hair, but I don't really think about the consequences it's doing, right?
Unintended consequences.
Right.
Yeah, so amazing. And Olivia, I wanna hear your opinion. Like when you hear all of this, especially Miguel, you know, it's amazing again that we can talk about this, to see the male point of view of this. So tell me what you think about the male point of view from your perspective.
Yeah, really, it's like, I think even as you mentioned, we think that a pill is gonna just put a Band-Aid on the problem, but really there's a root issue, there's a root cause that this is happening. So I always say, you know, for me, medicine is like the last resort. See what you can do naturally, see what you can really do to go inside your body and talk to it. It's crazy because our body has a consciousness and it is speaking to us. But oftentimes we're not even listening. And what I find too is, you know, having that self-awareness and just even if it's breathing into your sex organs, like how simple is that? And it is. I even, you know, I did think about, you know, how that, you know, circumcision, so thank you for saying that because that's a big one that people don't want to talk about it. But I find too, even with IUDs, there's trauma that happens with the cervix, and it breaks my heart because I've had multiple clients, and even C-sections too. It's like really there needs to be more awareness of the body and what we're doing to it so that we can bring that wisdom back to us and start to take ownership of our bodies. It's like the reclamation of power comes from you really knowing yourself and being that inner guide. So
I love it. Can I ask you a question? Sure. Yeah. So, well, I'm going to ask you guys. Well, let me ask you guys. Let me ask the men. Who has a name for their penis?
I don't.
You really?
I really don't. I guess I call him Miguelito. My name's Miguel, so it's Miguelito.
Well, and
or Miguelote.
You're like in your 30s,
Which
right?
one is really the I?
Yeah. So she's in her 30s and I'm in my 50s. So we got a little bit of age difference, right? You're my age area, right? Okay.
Yes.
And you're 40?
I'm 38.
God, you're the 30.
I've had a lot of
you got
damage.
the children.
A lot of abuse. That's why I look older.
Listen, honey. So I'm gonna use. I don't know. Can I use the P word?
Of course you can.
Sandy?
Listen, because nobody calls it a vagina. I mean, just look at my face when I said it. Vagina. Vagina.
And say the other word?
Vulva. Well, my pussy. Right? So, you know, a lot of it comes down to like breathing into it. Well, breathe into it, talk to it, name it, look at it, you know. So Nikki picked out my outfit today.
And who's Mickey?
She is my pussy. Yes. And I didn't start connecting to her until my late 40s, right? And that was the game changer. And some guy just asked, some 36-year-old buck in the back of the room at some point asked me, so is sex, what's it like as you get older? I'm like, oh. I'm like, we just wake up at 50, right? And part of it is because I consciously was like, I know I'm moving into a new era, right? My mommy stage, I'm moving into a different part of my womanhood. And it's much easier for me to knock out the inhibition part of my brain.
Yeah.
It's much easier, right? And the tone of the men or women I may choose to be with will be older, more mature, more confident, more swag. They can make me feel safe much faster. I can knock that part of my brain out. So it's a different experience than at 20 and 30. You know what I mean?
Amazing. So,
Could I give you my experience of what you just said?
Yes.
Go ahead.
Okay, that was your experience, right? So imagine a man who grew up watching porn, and I speak for the general, right? We think that you're supposed to have this twin tower penis, 25-inch penis, and not necessarily what you're seeing is reality. And we think that the way you're supposed to having sex and the size and all this, and most people are average or normal, right? And they're worried about their size, so they can't look at their, what do you call yours again? Nikki? So they look at Nikki kind of like, no, I don't even want to look at Nikki. They're ashamed of it almost, right? And then you talk about breathing into it. So as a Joe Dispenza practitioner, we talk about energy centers, right? Talk about your first survival energy centers, which are the first 3 energy centers, right? I've had constipation, I've had hemorrhoids, I've had urinary urgency.
And you're only 38?
38, but well, that was before. Now, well, hey, listen, I'm confident to speak about it on stage
He's got
because
a really
I don't have
hot
any of
wife,
those
so
issues
don't worry
anymore.
about it.
I'm confident to talk about it, but because you see, I'm in good shape, so you would think this guy doesn't have a problem. That's why when I look at somebody in shape, it doesn't say absolutely anything about it. How are they doing energetically? Where's their confidence? Where's their Nikita? Where are they, right? So it's very important to address, as you said, breathing to these centers and actually make sure, do you feel safe? I didn't feel safe for many years of my life, and that's what caused it. So I couldn't have that experience.
So very good. So one thing, Dr. Rimka, you talked about. So we focused a lot about ED, and we have 2 amazing women who are very in touch with their sexuality. But the reality is, ED also has a name for women. It's actually, it has an ICD-10 code to it. It's been pathologized. It is called hypoactive sexual disorder in women, HSDD. It's reimbursable by insurance because it is real and it happens a lot. There's many factors, not only the psychological factors, but there's hormonal factors. When you go to perimenopause, postmenopause, you get vaginal dryness, your testosterone level is low. Women don't enjoy sex a lot of times when there's hormonal changes like this. And I think our talk today is how to biohack this. So it gets to a point that if you have hormonal issues or physiological issues, not just psychological, there are things you can do.
Yeah, but I'm gonna she'll probably back me up, but the stress on your autonomic nervous system is going to drive that happening faster, depleting your hormones faster and making you have those symptoms faster. So absolutely, I'm a massive, bioidentical hormone replacement fan. I will use peptides. I love oxytocin, CBD, anandamide. I'm okay with using molecules to help bring sensation back to the system that has numbed itself out while we teach it to change behaviors through practices like, maybe tantric work, yoga work, fascia work, dealing with moving the trauma out of the body. Like, you have to address all this. These women are not sleeping, they're overstressed, they're trying to live in a 24-hour testosterone cycle like you're a man. You're not. Yeah. And I do want to get back to understanding, you never actually said it, which I was surprised, it's the performance, right? And you said that, get rid of the expectations. Because women start performing too. I'm supposed to perform, look like the girl on the porn and make all this noise and do all this stuff that's ridiculous. Mm-hmm. I'm that's not how it, I look at men, I'm that's not how it actually works, right? No woman actually likes that. Wow. But okay. So I'm not going to say it. So, but you didn't talk about, for me, every time coached any of my patients, it's when they get sick, they forget about the fun, they forget about the pleasure, they forget about the joy. So we start simple, because going all the way to sex and orgasm you can't fathom that when you can't walk to the mailbox, when your energy level's a 3. So it is with simple things, like getting into the senses, smells, could be essential oils, it could be buying flowers, it could be just how you dress and beautifying yourself. And for men, it's a little bit different, but for them, it's usually in how they can please the woman. Usually it's I get my swag by how much I know I've made you happy. All I want to do is please you. Just please tell me what to do, right? And I think so many women, I find it in my patients all the time, they just unknowingly are emasculating their husbands, right? By always trying to be so overly competent in everything and basically not letting him do a damn thing. I mean, I will break shit on purpose just so you can fix it. I'm like, oh, I don't know what that is. I guess you should fix it. I'm like, there's some heavy stuff. Why don't you carry it for me? Okay. I'm like, you big man. Yes. See, it's all that you guys don't need a lot.
Yeah.
You know,
Simple,
you're very
we're simple
simple.
creatures.
We're very complicated.
Yeah.
But if we just keep you know what I mean? So, you know, no part of that is like, yes, you want to, the point of performing is because you want to please her.
As long as she's happy, I got good food, I'm comfortable, I'm fine. I don't need a lot. Very simple.
Sometimes the sexiest thing a man can do is do the dishes. And she'll be happy. She'll get you some after that, right? So
I do
really
them, but they complain all the time that I don't clean them right, so I give up on it.
So paying attention to each other's needs, I think what we're all saying here, although performance is really important, communication, presence, being present is really one of the most important things that we can talk about. So now we have about 10 minutes left. This is really about biohacking. Although I think we talked a lot about touch, feeling safe, feeling comfortable. Let's talk about maybe each one of you panelists, your favorite biohack to better sexual health. And I'll start with you, Olivia.
Yeah, so one thing I feel that we didn't touch on was intentionality. So what your intention is going into an experience will change it completely. Because if one partner just wants to release energy and the other partner wants to open their heart, there's going to be a huge disconnect in the sexual experience, post-sexual experience. And oftentimes what I find is stop looking at still as an A plus B plus C journey. It's really not so goal-oriented. When we can really remove orgasm as the goal, we start to enjoy the process. And that is when the discovery, that's when the play can come alive and your whole sexual experience changes because you release the pressure that, oh, I have to perform this way and need to please her, because it is a dance. It's about giving, about receiving, and being able to dance within the experience. So.
Beautifully said. So intentionality, amazing biohack. Thank you.
Hopefully that was biohacking, so I don't know.
I love it. I love it.
Not a science fact.
Miguel, what would you say your biohack for better sex is?
So since we got limited amount of time and we have a running medical practice where we have real patients and real solutions, I'm gonna give mine, which is a whole gamut of things. Again, it's not just a one thing approach, it's a multifactorial solution. Number one, if you're impacted, which tomorrow they're gonna have a talk on endocrine disrupting chemicals. It's an epidemic. It's the 800-pound gorilla in the room that we're not talking about, and it's affecting our hormones, and that's why women are becoming more the masculine and men are looking more like pears and they're more feminine because there's a biological attack on our system. Number one, so if you're low on testosterone, check your testosterone, treat it with the proper doctor if you are low on it. Because if that molecule's low, you're not gonna crave sex, you're not gonna feel confident, you're not gonna feel dominant. That's what makes men, right? Testosterone. So number one, testosterone. Number two, if you have an endothelial issue. So the definition of erectile dysfunction is endothelial dysfunction. Meaning the blood vessels, if you don't use them, you lose them. Just like muscle, if you don't use it, you lose it. So if these blood vessels collapse, you need to use something like acoustical shockwave therapy to reinitiate neovascularization, to regrow these blood vessels. And I like to call it, how old are you, sir? How old are you? 56, imagine not having an oil change in 56,000 miles. And I hope you consider this your Ferrari. So imagine not changing the oil to your Ferrari. But this oil change, you actually get to feel, see, and enjoy, right? Then nitric oxide. I started with daily Cialis. Then we met Dr. Nathan Bryan, and we understood that PD5 inhibitors like Viagra and Cialis are downstream of nitric oxide. Nitric oxide is what turns the light on, and then PD5 inhibitors dim the light up and down, but you need to make sure you have healthy vasodilation. So if you're under stress, danger, and you have pre-genetic disposition like me with high blood pressure, then you have a problem with endothelial function. So nitric oxide. Then we can get into PT141. There's so many peptides, so many routes, oxytocin, but I'm not gonna get into those. What else? I need to make sure they understand that. No, we got time, who cares? We'll go over. Everybody here has gone over. We'll go over 10 minutes, whatever.
Go ahead.
Okay, doesn't matter. It's the end of the day or the end of the night. So PD5 inhibitor, for example, I was taking daily Cialis 10 milligrams. Now I've gone to 3 times a week because I restored my nitric oxide function. And there are many nitric oxide supplements out there. We've learned that very few work, if not any at all. So that's why we recommend Dr. Nathan's Ryan product. You can look them up online. Okay. What else? Oh, the elements of ancestral biological living. What I mean by that, not everything is an injection, a pill. You have to put your body under adverse states. Today, we are lazy as F. We don't move our body. And I used to be chunky when I was a kid. Now I'm in the best shape of my life, which I thank those people that called me chunky, by the way. The point is, what I mean by ancestral biological living. There are a couple of elements to that. Number one, we only experience short-term stress. Number two, we exercise as a natural component of our survival. Today, we pay people to work us out, right? 3, we drank pure, clean water that was rich in essential minerals and trace elements. Today, we have to filter our water, and then you have to remineralize it. And most people don't even know that. They just drink reverse osmosis water, which is basically dead water, and they're not putting these minerals, which are electrolytics that, again, you see how I can keep going? There's so many pieces to it. No, I'm not done.
Miguel.
I'm not done. I'm not done. I'm almost done. So, environment, EDCs, artificial lighting. Why have these glasses? These are just Band-Aids, right? Pharmaceuticals in our water. And then the last one is intermittent fasting. Before, we used to experience prolonged periods of hunger, which are better known as intermittent fasting. That resets your reward centers so you actually work for what you want. Cold plunge, sauna. There's so many ways to, if it doesn't kill you, it makes your body stronger, right? And then the last one is getting your central nervous system back into check. So I'm gonna leave it there, but there are many other things. So you see, it's not just one single thing. There are many ways to approach this. And when you do that, you will solve your erectile dysfunction. As a man, you will fix it, because I had severity at 18 years old. I'm 22. And to be 38 and be able to stand up here and talk about it with confidence is something that is dear to my heart, because this is the statistics. 45 to 50% of 45 to 50-year-old men today are experiencing some form of erectile dysfunction. And it increases by 10% every decade. That means by the time you're 70, there's 70% of men without erectile dysfunction. And when you got to satisfy the Nikita, that's our relationship up in divorce. So marriage is a constant work that you're working on, and you have to be able to perform and show up to your day at 100%. So my final say is that fixing your erectile dysfunction, or erectile, what is it you call it? Disappointment is also improving every physiological aspect about your body as a man.
Thank you very much, man. This was amazing. Great talk. So
That's why you took those notes.
yes. So now,
He
Dr.
had notes.
Rimka, what about you? What is your biohack about better sexuality?
So, ditto to all of that. It's a very masculine approach, right? So many of those things would deplete a woman more, so I wouldn't suggest that same approach. I'm a huge fan of replenishing hormones. I think they're being artificially stolen and ripped apart from us much sooner than they're supposed to be. It is not natural what we're seeing going on. So replace. This is one of only 3 practices I refer everybody to. So they know what they're doing, because it can be done wrong. It is not taught in medical school. They're taught not to do it. So everybody who's out there trying to do it is basically being self-taught. I give everybody credit, but it is a complicated field with a lot of misinformation, like blocking estrogen in men. You should never be doing that, but that's kind of the standard thing most of them are doing.
99%
right?
of them.
Yeah, so it's a real problem, and if you don't know why, we have friends that have incredible lectures to explain how that's destroying bone health and cardiovascular health and mental health for men as well. So for me, that's step 1. We do need to do that. I'm going to leave it with this, because if you're dealing with, as a woman, and some of this is trauma-based, trauma is a mitochondrial disorder. You are low in energy. You can't actually start doing things, working out, training for marathons, and cold plunging if you're actually in a dissociative trauma state. You need to deal with this from a mitochondrial level to start nourishing and healing yourself, probably working with a clinician, getting down there at the cellular level to deal with that. Then you move the next step into fascia. Believe it or not, this is helping you have better sex, because traumatized, dissociated people are not present in their bodies. You aren't feeling any sensation. You aren't having pleasure. You're faking orgasms. That's why women aren't having them more than men all the time. So I would be dealing with, if you're dealing with some trauma, we deal with mitochondrial health and everything that goes into that, as well as fascia. I love trauma-releasing exercises, TRE. I'm certified in that. It's one of the most profound things I've brought into my practice in many, many years. I'm also board certified in neurofeedback. I think neurofeedback is one of the best central nervous system regulation systems out there. You kind of stack all those, working with somebody who's dealing with the molecules, and you really can heal the entire system. And then through that, you're usually working with a clinician who's helping you with connecting to yourself. Intuition is raising, because as soon as you start getting connected to the self, naturally you're connected to source, and so your intuition is there. And for women, that's how we get our swag. Our superpower is our intuition, our empathy, and our compassion. And if you are stuck in a trauma state and you feel unsafe all the time, you won't even feel connected to yourself or trust yourself. So I guess that would be my biohacks around.
Jack up yourself.
Amazing.
I just want to add to that too, because a lot of, on the physical sense, is vaginal de-armoring, and our vagina is a muscle. So same thing, going in there, breathing in there as we're releasing things from years, I'm telling you. And same thing for the men, it's testicular massage. So get in touch with your body and just be there, not for pleasure, not just for pleasure, but just to get in touch with the body.
And do it in the sunlight.
Oh yeah.
Balls in the sunlight.
In the moonlight, in the sunlights.
Everybody should have some more. I mean, just think about it, connecting to nature. Like, when's the last time your breasts had sunlight? When's the that time the Nikki had any sun? It's illegal, right? I mean, that's not natural.
We didn't get into that, but discharging onto the earth, all the current, alternate current that we accumulate, discharging and grounding.
Amazing, amazing. What an amazing panel. And I have to say, this is a biohack weekend, but we underestimate the importance of sex. Yes, we are energetic beings having a human experience, but the human experience needs sexual contact. And I'm not saying just need sexual release, because sexual contact can be done without the desire of releasing. We need touch, we need connection, we need to feel safe, and we need to connect sexually.
Sex sits in the same part of the brain as eating and drinking, and people seem to act like it's not. It's not a non-negotiable. It is.
It is necessary. The previous speaker was talking about. We talked about lifespan, then we talked about health span, and she talked about sex span. How long are we going to keep our sex life going? There should not be an age when you stop. And sex, we need to redefine what sex is. Sex doesn't mean release. Doesn't mean all the time performance. It means connection. So, thank you very much, all our panelists. I think they were great. Thank you.
Also, at 7:15, I have Soulgasm, a tantric experience upstairs. So if you want to explore desire and that life force energy, your kundalini, come upstairs.
We will all be coming. Thank you.